So now that you have these awesome referral materials, here's just a couple of ideas that you can use them. But honestly, there are way more ideas than I can even just rattle off the top of my head. So please share with me more ideas because this is all about trying to help, especially community, reach more patients, change more lives, and just spread awareness about especially eye care. So off the top of my head, if you think about it, one of the best targets is always going to be other optometrists, where they have a lot of kids coming in. I think the average across an optometry practices for patients under 18 is around 15 to 20% of their patients. And so an average practice who's seeing 300 patients a month, they're going to be seeing somewhere around 50 kids, maybe more. Then you have pediatric ophthalmologists, you have pediatricians' offices, and then of course you have educators, and educators are great. My mom's an educator of younger kids for her most of her life, for around 40 years, and they care passionately about their students. And if they see something that isn't going well, so you have first grade, kindergarten, as the child's going into the reading age and starting to grapple with the visual needs in a classroom, that's always going to be beneficial. You have reading specialists. Of course, with private versus public school, private schools have a much more easy time to refer patients, whereas public schools might not. But that doesn't mean that you can't educate the teacher, and they may not be able to officially refer a patient, but they may talk about it with the parent. Um, you will also have, I've heard a lot of practices who have a lot of referrals coming from homeschool organizations, and that can be really beneficial. And they're always looking for material to send out to their members. You have PTA groups. And then you have reading centers, after school curriculum kind of building programs that are great. You have speech therapists, uh, pediatric occupational therapists, pediatric physical therapists. There are school nurses, and that's just kind of on the professional side. Obviously, there are even more. Anybody with pediatric in their name is going to be a great one to try, at least to educate them. And a lot of times they won't even know. I have a great aunt who is an English teacher for many, many years, maybe 60 years. And I actually shared with her this, something similar to this. And she was blown away. She was like, I never knew about all these things, that these can be vision related. I mean, obviously, if you're watching this, you probably know and have heard similar stories, but it's always great just to use this kind of material, especially the vision symptom checklist, to educate different people who interact with kids a lot at this kind of junction of learning in the classroom and vision. Um, then you could also use it in different ways. So you can send it out by email, you can post it on your social media, you can send out in mail, you can drop by an office, bring some goodies for the staff, and have some of these for the office. You can put it in your office in the waiting area. You can send it as to the parents who are your current patients and say, hey, do you know anybody who might benefit from this? You can include it in part of the therapy packet. And when somebody starts therapy, they can check this off and they can maybe see how they've improved on some of these symptoms at the end. You can have this on your site, which is great, on your different social media platforms. You can have a webinar and give this away on the webinar. You can have an in-office, in-practice kind of educational event, whether it's for parents of kids going into first grade and or teachers in the community, and this can be one of the things that you hand out to them. So there are really a tremendous amount of ways that you can use this, and we've only kind of talking about one uh, kind of referral material, but obviously there are many different things that you can use similar to this. Personally, I really love emails or even sending this in a message on social media because it's cheap, it's easy, it's time efficient, and always say, I could bring you print copies of this if this is something that interests you. But oftentimes that just saves you a lot of effort from printing up a whole bunch of expensive ones and then not really sure what you're going to do with it and everything like that. So I hope this was helpful, and I am sure I didn't cover even half of the opportunities to use this, but I hope this still helped a little bit. Thanks, and good luck getting more referrals for your practice.